Assalamu alaikum. In this video I am discussing about a common station hereditary spherocytosis. It comes on exam. So normally I am telling some interpretation of finding. That is a child that present with pallor with jaundice and organomegaly, but there is no clubbing. So pallor, jaundice, organomegaly. We can keep the DD chronic hemolytic anemia. In chronic hemolytic anemia, including thalassemia can be. In thalassemia we find hepatosplenomegaly. Sickle cell anemia we find only hepatomegaly. Sickle thalassemia, here we find both hepatosplenomegaly. Then hereditary spherocytosis, what I discussed. Hereditary spherocytosis is splenomegaly or splenectomy scar. That is a Kocher scar for cholecystectomy. These are also hepatitis, Wilson disease, congenital hepatic fibrosis. It is an autosomal recessive with hepatomegaly and normal liver function. So these all the finding associated with pallor with jaundice and organomegaly with no clubbing. Okay. So we are discussing hereditary spherocytosis. Hereditary spherocytosis is an autosomal dominant conditions and it is common in Caucasian and North European. And general examination, what we find, the child is appears well, average for age, pallor with mild jaundice. And local examination we find there is a Kocher scar for cholecystectomy, splenectomy scar, either big scar or 3 scars for endoscopic removal of splenomegaly plus minus mild hepatomegaly. So Kocher scar for cholecystectomy, splenectomy scar, either big scar or 3 scar for endoscopic removal or splenomegaly plus minus mild hepatomegaly. So in examination we are telling the positive finding, what we find in the exam. Then we are going for the investigations. What we do in clinical, first we tell the confirmatory test, that is EMA test, eosin 5 millimite. Then genetic test and counseling. Full blood count we find normocytic normochromic anemia with reticulocytosis. If aplastic anemia, then pancytopenia is due to parvovirus. We do the parvovirus B19 serology. Blood film we find anisocytosis, poikilocytosis with nucleated cells, spherocytes, total and direct bilirubin, liver function test, abdominal ultrasound. So the investigation again I am telling, EMA test, that is eosin 5 millimite, genetic counseling, full blood count we are doing, liver function test we are doing, then peripheral blood film we can do, abdominal ultrasound we can do. These are total and direct bilirubin, and parvovirus B19 serology is important here, it causes anemia. Treatment is folic acid plus minus splenectomy plus minus cholecystectomy. So folic acid we are giving, splenectomy if needed, cholecystectomy if needed. Advice, we give some splenectomy advice, avoid sports, these are avoid infections, wear bracelet, genetic counseling because it is an autosomal dominant conditions. That is okay. And sometimes it come in exams, they will tell that, like her sister also, sibling has the same conditions. As we know, it is an autosomal dominant condition, so they can be tell that the family member also same conditions. That can we easily pick up this. So this is all about hereditary spherocytosis, which is under chronic hemolytic anemia. And chronic hemolytic anemia including, we know, thalassemia, sickle cell anemia or sickle cell disease, and we include hereditary spherocytosis, also the hepatomegaly causes all are. So this is all about. Thank you.